Hi guys, Dr. Pelto here. I get a question all the time. What do I do or why do I have pain on the top in the middle of my foot? That's what we're going to go over today. What you'll see here is a picture of someone's foot, and right in the middle of the foot region, there is this bump. Now, this bump can be a lot of different things. Occasionally, this can be a cyst. I had a cyst recently, a patient that had a bump here. They had a cyst that developed, but underlying that cyst, which is called a ganglion cyst, I'll put a little video underneath here on ganglion cysts if you want to learn more. But a lot of times this is caused by midfoot arthritis. What is midfoot? Midfoot is in the middle of the foot. You can get spurring. And the best way to see this is on an x-ray. You can see these spurs, and what happens, I always say, it kind of looks like mountains. When you look at an x-ray on the side, there's these mountains in these spurs. And in this spur, it can weaken the capsule that covers the joint, and it can cause fluid or like a ganglion cyst or some type of a cyst. But more importantly and more often, what happens is this can cause midfoot arthritis. Well, what can you do? Well, there's a couple of things that you can do. What I really usually start with is trying some type of a cortisone injection that can calm it down. If that doesn't work, you can try to reduce the movement, because the more movement there are in these joints, the more pain you're going to have. There are some advanced treatments such as shockwave therapy that can work sometimes for arthritis. There are orthotics that can reduce the movement. And then there is surgical repair where you shave down that spur or do other type of fusion of that joint. So this is an example of this type of a joint that develops this arthritis. So if you look at your x-ray and you notice this arthritis forming, what would be some of the causes? Well, having a flat foot or a foot that collapses, that could cause this type of an arthritis, or having a lot of movement in the foot. So there are some braces that can also be used to reduce the movement. Once again, hope you found this helpful. I'll put a couple of more resources, or my new patient welcome packet down there. That's going to be a lot of resources in arthritis. Okay, thanks. Hi, I'm Dr. Don Pelto. I'd like to welcome you to my YouTube page. And on this page, you're going to find a lot of resources that I've set aside for you if you are my patient or if you're here just learning about your foot condition. I'd like to give you a little tour and share a little bit about what we have to offer on this website. First, I've had it organized by my patient resources. These are resources such as our office newsletter, our webinars that we do, or different types of things I'm providing specifically to patients in the office. As you scroll down, what you'll see is a section that's called Ask Dr. Pelto. You can submit your own question and I'll answer it in one of these episodes. And then what you'll find are a list of videos based on topic under the foot problems. And at the end, what you're going to find are my books. Put a little link here on the upper right-hand corner. If you click that link, you're going to get a link to my website. And on here, you're going to find a list of my books. I want to thank you for visiting drpelto.com on my YouTube page, and I look forward to helping you or educating you with this information.